Meg and I are in Tallahassee. We are doing an Allergan training tomorrow, and we're hanging out in bed, and we were scrolling on TikTok.
We're in our jammies.
It says, I love Sunday. And we were looking at this video, and this young girl, she was in her mid-20s, was talking about getting her cheek filler dissolved. She had it about a month ago, and she felt like it made her look different. And we were chatting because we've had a few consults recently to get their facial balancing dissolved. And I wanted to say how important it was to let the patients know that whenever we're doing facial balancing, when we're doing cheek filler, chin filler, anything that is changing the structural components of your face, it also is usually changing the shape of your face, and that can be really hard to get used to. And if you're not anticipating that as a patient, it can be like a little bit of a shock. And most patients get used to it and they love it, but some patients don't really understand what the outcome is meant to be,
Right.
and they just don't feel like themselves anymore.
Right. And also, too, facial balancing often requires multiple syringes of filler at once.
Yeah.
So it's not like when a patient comes in and they just want chin filler or lip filler, that's just one area of the face, maybe two areas of the face that you're changing. But when you talk about facial balancing, that's multiple syringes of filler and usually in multiple areas of the face. So I just think it's important that we as providers are honest and upfront with the patients when we consult them for that and let them know this is going to change how your face looks. And most of the time, like you said, they get used to it and they love it. But it's important that we talk to them about it first.
Yeah, and I think a couple of things can make facial balancing even better, which is making sure that you have seamless transition zones. Because
Right.
if a patient comes in and we're contouring only the bony structures and we are giving highlight to the cheeks, we're doing filler in their jawline and their chin, but we're not blending their submalar area, we're not blending their temples, we're not blending their mental crease, it can look a little bit Maleficent-like, or it can look a little bit strange.
It can.
And so make sure that your provider is blending everything together.
Right, and imagine if they don't know ahead of time and then they have swelling on top of that.
True.
And their cheeks are like huge. Like I looked like Maleficent after I got Sculptra.
Which definitely happens.
But I knew that. I knew that going into it. And if they don't know that and you're not telling them, hey, before we do this, this is where we're putting filler. This is going to look kind of weird to you at first. But I knew going into it. So I think having the conversation beforehand is important.
Yes. And just making sure, again, that you're having that conversation that facial balancing is meant to change the shape of your face.
That's exactly right.
So maybe sometimes having the provider do it in sessions, because it doesn't have to be done overnight. So a lot of times at Mila, instead of doing 6 syringes at one time, I've done that occasionally, but typically what we do is we'll do 2 syringes at 2 to 3 visits. And this way the patient is able to see the transition over time, and we make sure that they're loving it, because it's a lot easier to take your time and build the areas up rather than investing all that money and then also having to pay for Hylenex.
Yeah.
So I think that really just making a care plan, giving the patients lots of education. We really lean on education a ton, making sure that we're on the same page. And I've turned patients down for treatment sometimes because I feel like we're not quite on the same page.
Right.
And I will not treat them that day, have a conversation, and then even have them come back at a later time and reconsult them again, and make sure that we're both clear on the desired outcome.
Yeah, I think especially in my clinic, I really try to set a treatment plan up with them on the first consult and then just treat a couple of areas. Very rarely do I do more than 4 or 5 syringes at one time. Same with lips. I feel like it's better for you to build on them versus just throwing, a syringe and a half in there at one time. It's just a lot, and there's a lot of swelling that goes down with that. And with facial balancing, I'll say, okay, listen, let's treat your cheeks today. Let's treat your cheeks and your chin. And then you come back, we'll maybe add temples, jawline. So It doesn't have to be done in one session.
Yeah, I think most of the time, I think you do the same thing. We usually use about a half syringe up to 0.7 in lips. And that for most patients is just enough to have a beautiful result. And the reason that we like to do less is for the final outcome, because sometimes you see lips that look really good initially, but you're not seeing the final result. And what happens is that when the filler is placed if too much filler is placed at one time, it's going to go to the area of least resistance. So instead of it staying in the pink lip, it ends up moving above or below the lip. You're also increasing your risk of adverse events whenever you have a lot of filler at one time, because you're getting the risk of compression, even if you don't have filler into a vessel. Same thing with the chin. The chin compartment is very small, so I personally don't do more than 2 syringes at a time in the chin, and then I'll have them come back because of the risk of compression.
Right. And we have that conversation with the patient. So most of the time they know, we're just going to start with a syringe and a half for the chin. I've done 2 on someone, but she could hold it.
Yeah.
And then I said, you're probably going to have another syringe. We'll just come back in a month or so.
Yep.
See how it looks.
I love facial balancing. I think that if you have a patient that's coming in and they have tons of volume loss, especially these days with weight loss, they're coming in and they just want their lips done, it is our due diligence to tell them that it may look unnatural, because if we have smooth, full, voluptuous lips and everything around it is kind of sagging, it can look unnatural. So,
and sometimes you need chin filler and, like you said, kind of mental crease area just to support the lips.
Yes.
They want these big, beautiful, full lips, but they need more support around that. And so it's important that we talk to them.
Yes. So we love facial balancing. It's just respecting their natural features, respecting ethnicity, respecting gender. There's so many things that we have to take into consideration to have a beautiful outcome that the patient loves and they feel like themselves just a better version.
Yeah.